second wave, it was a lot harder. They were less willing to tell people they had to stay in their homes for a while. They were less willing to ask people to sacrifice for the greater good in many places. And so I think that's where we saw this, these decisions became even more influenced by political affiliation.
Hello, everyone. I know many of you like traveling, so do I. But during COVID-19, our wanderlust was put on hold as restrictions and lockdowns hampered travel worldwide. But even in the face of these challenges, leadership played a crucial role in shaping our experiences. So what lessons can we learn from the leadership styles in 3 countries during this global health crisis? Join us as we continue our series diving into the edited book, COVID-19 and Public Health, edited by myself, Dr. Caroline Kingori. Today we focus on a chapter titled Public Health Leadership in the Times of COVID-19, A Tale of 3 Countries, where our guests, Drs. Pablo Villalobos, Dr. Claire Chaumont, and Dr. Jeffrey Glenn will tell us more about the 3 countries. You can find the edited book at Amazon.com, Ohio University Press, Barnes & Noble, and all other local bookstores. So join me in welcoming our guests to the show. Yay! This is so exciting. But before we dive into the book, I'm going to ask each guest to just briefly introduce themselves and their motivation behind writing this chapter. We'll start with you, Dr. Pablo Dintrans. And he has asked me to call him by his first name, Pablo.
I would say ladies first.
Okay. I guess that would be me. So my name is Claire Chaumont. I'm from France, which is one of the countries that we talked about in the book. Jeff, Pablo, and I all met during our doctorate in public health at Harvard, and we've all been working in various capacity in public health since then. I work as a public health consultant based in California. Until very recently, I was with the World Health Organization, focused on country-level implementation. And I've also been working for the last almost 20 years in different aspects of public health, from infectious diseases to, most recently, determinants of health. And I'm particularly interested in leadership. I think for different reasons. The first one is that I see emerging challenges in public health that I think require a different type of leadership than the one that we've been used to more recently. I have a background in public policy, and I'm often surprised by how little public health leaders seems to know about the word out there. And I think this is something that we need to think about, especially in a moment of crisis where, like COVID, it's not just a public health crisis. And I think, I think of what's happening with climate change and health, and I think there's a need to really think about how leadership is playing a role in the way we implement policies. Now back to you, Pablo.
Thank you, Claire. So my name is Pablo Villalobos. I used to work as an independent consultant in public health, Claire, but now I'm proudly associate professor of Universidad Mayor in Santiago de Chile. So, like back when we started thinking about and discussing about writing something for this book, it came up naturally, I would say. I mean, we are all 3 from different countries, so we used to talk about like public health and what happened in our countries, just checking like in each other's day-to-day life. COVID-19 was, of course, a disruption in our lives. So we were talking about like what's happening in your country at the time. I don't remember, but I think Claire was living in the U.S. or in France. I was here in Chile, and Jeff was in the U.S. So naturally, we started discussing and what's the situation in the country. What are you doing? How do you see this? Where this is going? And the issue of leadership quickly became something that was very important, and at the same time, there was very little discussion about it. we came, as Claire said, we studied together. We came from a program in which leadership was an important component. So we tend to think that this is something relevant, and this is something that public health practitioners and scholars should be thinking about. So yeah, I think that as I say, the motivation for writing the book was very organic. We just were talking about our experiences, our day-to-day lives in our countries, and with this focus, with this lens of public health and leadership.
Yeah.
Go ahead, Jeff.
Me, yeah, okay. Sorry, I didn't know if you were saying something. Thanks, Caroline. Yeah, I'll just echo what Pablo and Claire said and add my introduction. My name is Jeff Glenn. I live in Provo, Utah in the United States, and I'm an associate professor of public health at Brigham Young University. And I teach and do research on public health policy and public health leadership and global health policy. And so I think it was frustrating for many of us during the pandemic to see both locally and globally what was happening. And for me here, and we'll get into this, I think, later, in a fairly conservative red state in Utah, seeing how our policymakers were responding differently and seeing how leaders in different situations were interpreting things differently based on their politics. And it seemed like many decisions were straying very far from what the maybe the optimal decision would be based on what the science is that was known at the time. And so it became really interesting to me, along with Pablo and Claire, to look at kind of leadership lessons from our different situations that we were studying, but also that we were living in the moment of the crisis.
Wonderful. So I'm really excited to dive into your chapter and talk more about what was happening. It's exciting that the three of you represent 3 countries anyway. So this is going to be a really rich discussion. So I'll start with you, Claire. Looking back, what were the biggest leadership challenges each country faced in the early days of the pandemic?
Yeah, thanks. So I think before we dive into the leadership challenges, we should maybe remind everyone a little bit about the facts. I think we all have collective amnesia, and we all want to try to forget that time. But, end of 2019, we've got an unknown respiratory disease that's reported to WHO by China. Very quickly, WHO declares it a public health emergency of international concerns at the end of January. And then very quickly, it spreads across so many different countries. And also maybe to remind, I guess, the audience that since then, we've had 700 million cases of COVID and over 7 million reported deaths. And these are only reported deaths, right? So I don't think we had ever lived through an epidemic outbreak of such major scale. I mean, we hadn't. So in terms of the crisis, it means several different things. The first thing is that we're talking about a public health crisis, which means that we need specific knowledge and experience. It's different from maybe different political crises. The second one is obviously, as I just mentioned, the unprecedented scale and the fact that we're really talking about a crisis that affects every single country in the world and where the coordination across country becomes essential. The third thing is that it's a public health crisis, but very quickly it becomes more than a public health crisis. It becomes a social crisis, an economic crisis, an educational crisis. And we know from previous outbreak, especially the West Africa Ebola outbreak, that countries tend to be quite reticent when it comes to, kind of like the balance between public health and economic factors, because the public health measures that public health professionals recommend tend to have a disproportionate impact on national economies. And in a lot of countries, kind of we've seen this tension very clearly. And then the last piece, and I think one of the most important for this crisis, is that we're talking of an unknown pathogen. And at the very beginning, we really have no information, very limited evidence on the modes of transmission, on the populations affected, and on what's efficient and what will kind of put a stop to the disease. And I think this is a quote that we put in the chapter, but the Prime Minister of Netherlands at the time, Mark Rutte, summed it up by saying, in crises like this, you have to make 100% of the decision with 50% of the knowledge and bear the consequences. So I think that's the biggest leadership challenge at the beginning. I want to bring here the framework by Ronald Heifetz called Adaptive Leadership. And Heifetz, who teaches a lot about leadership and kind of systems and the interaction between stakeholders, provides definition of leadership that's different from authority. He argues there's a difference between authority figures, which are people that have received formal authority to, play a role to organize people, and leadership, which is more around kind of engaging different people and kind of working together towards change. And what we're seeing in moment of crisis is that these tensions become heightened in a sense. On one hand, we need pretty decisive hierarchical leadership, and people are going to be looking up to that authority and asking them for answer. While at the same time, in a moment of crisis like COVID, especially considering the lack of information, what we actually need is transformative leadership, kind of distributed leadership that is able to incorporate the perspective of multiple stakeholders. And so we're really seeing a tension there between kind of, what we want, which is very hierarchical, we're going to do this, and what's actually needed, which is bringing people together. And I think the second piece where we're seeing it very clearly is in the realm of communication, which is, on one hand, you need very effective communication, kind of where people are going to tell you, this is black or this is white. When in reality, we don't really have all the information. And for leaders at the beginning of the crisis, we really saw that tension of kind of being able to articulate what's known and what's not known in a way that's going to reassure citizens.
That's really a great introduction, and for reminding us what COVID is about. We are at that place where people want to forget that. But even incorporating that quote was really critical. And for Jeff, I just want to know if what your thoughts are with this question, especially with what happened in the US and the leadership at the time, whether it's the delay or the timing or the communication of COVID.
Yeah, thanks, Caroline. I'll just build on what Claire said and share that, for example, in the US, we saw, right, as Claire mentioned, this need to leaders have little information and they have to communicate, and people are scared and people are looking to them for information, for decisions. They want to feel like everything's going to be okay. So this is really hard task of leadership in this early stage of the crisis was communicating with certainty and authority in a way that could help people feel confidence in their leaders, which would help the leaders by, they're able to maintain their power and authority and be able to lead people through the crisis because they have projected this authority. But at the same time, somehow communicating uncertainty. And we saw this in the US with things like in the very early days, masks and lockdowns, where there was a lot more uncertainty than there was information. And I think that for the most part, in the US, I think probably you could say this about around the world as well, especially if you saw this in the US, that leaders did a good job trying to project this authority and confidence, but not at communicating the uncertainty. And so then when we got new information, when we learned that actually maybe everyone should be wearing masks based on what we learned about the virus, that made it hard for people to continue to trust what the leaders were saying. So they kind of had to choose between the leader and the science, and then, I think went downhill from there in many cases.
That really describes a very scary moment, right? When everyone is looking up to these leaders, but no one really had an idea of what was happening. And Pablo, I would like for you to talk a little bit about that interplay of these political aspirations or agendas and this scientific advice that was happening at the same time as the outbreak, and what that impact had on public health decisions in these countries.
Yeah, I mean, I think that the main challenge was, and then the origin of the problem was this lack of information. At that time, I was working at the Chilean Ministry of Health, and we had this kind of mantra motto thing that to try to put in all people who work in the ministry, that was evidence-based policies. And as Claire said, we had to face decisions in which we have no information at all, and all our training and all our speeches saying that all the policy should be evidence based was useless. And I think that create this tension that you name, that between science and politics, because at some point people making decisions simply said we need the scientists, but they are not telling anything, right? It was a scary moment. I remember being at the ministry, and every day we had requirements asking whether should we use masks or not, or is it safe to push the button to cross the street, or should I put some special product to wash my fruits or whatever. In Chile, and I think in the other countries too, we talk about a little bit of this in the chapter. There was this moment in which we have the pandemic and the leadership crisis that allows other people to try to fill these positions of leadership, right? In a time where the authority was not enough, and people wanted to know things and wanted to know what to do. And I don't think you remember, but in Chile we were living in a very, very complex socioeconomic and political situation at that time. We have a huge social outbreak right before the pandemic, and something really was you can say was happening in the US and in France. You have both countries were facing political elections. So yeah, I think having the lack of information, and this weird political environment created this this fight for, not for power but for leadership, and generating this tension during the first month of the pandemic, in which we saw a lot of new voices coming out saying this is what we have to do, and then trying to position themselves as leaders of opinion or scientific leaders, and creating this tension between politics and science that at the end was solved. It took a lot of months, and we realized that we need more collaboration rather than fighting for trying to decide who was the person who had the truth, the real truth.
Indeed. And I'm wondering, Claire, if there's anything there you want to add, because at the end of the day, this boils down to that communication and what is being put out, but also what's being understood, right? And then the political aspirations. All these countries, most of them are going through socioeconomic issues. There was the also elections and so many other things that were happening. So anything you want to add with regard to that interplay?
Yeah, I think maybe to build on what Pablo was saying, I think this is a paradox that we're actually seeing for a lot of public health problems. I think public health leaders tend to be trapped a little bit into a paradox. On the one hand, because the public health discipline is so evidence-based, this is really kind of what gives gravitas to their claim. So they, take their legitimacy from science. At the same time, and we're seeing it more and more, not just with epidemics, but with, a broad range of public health challenges. In order to advance implementation, you really need to get into kind of the messiness of the political process. And by doing so, you need to be okay to weight the scientific evidence against other factors. that's something that I think public health people don't feel very comfortable, and rightfully so, because if they go too other hand, they may be perceived as not scientific enough. In a sense, they have this legitimacy trap, right? You focus on science too much and you may not have any impact. But if you focus too much on politics, you may end up losing your legitimacy. And that's what gives you your voice in the first place, right? And I think we've actually seen that, some of the countries that had that maybe were better prepared, countries in Asia maybe were countries that had already kind of gone through significant epidemic outbreak and maybe were better prepared to, bring the voices of public health leaders, and bring them to the table. I think a second piece that's interesting to think about is, there's this tension between the scientific advice and kind of the political agenda, but there's also a question about implementation. And I think what we've seen is how institutions are organized, what's the role of the scientific committees or whatever was put in place, and what power did they have within the system to be able to push for implementation was so different across country. I mean, I'm thinking of the US, and I'm sure Jeff can say more, but the CDC could say whatever they wanted. At the end of the day, it was up to the different states to design and implement the policies. So that was very different in France. France is a very centralized country. They set up a committee, a scientific committee that was reporting directly to the government. It was very centralized, for good or for bad. But I think kind of the way political organizations are organized and how the power is distributed also play a big role in terms of how the scientific voices can really kind of support implementation in moments of crisis.
Indeed. And Jeff, you started telling us about effective communication, and, Claire has talked about that, whether it's decentralized or it's centralized, the benefits and the pros and cons of that. And I'm wondering if you have any additional information on, do you think leadership effectively communicated? You kind of started that conversation, and maybe you can dwell more on what could have been done differently,
Yeah, great. Well, so to when we wrote this chapter that's in the book, we used a framework by Boyne, a crisis leadership framework to understand, try to make sense and understand what the different phases of leadership were and the types of leadership, and make sense of the COVID pandemic situation. And this framework has 5 core tasks. It's called sense making is the first one, and that's just recognizing there's a crisis and figuring out what it means for, or what it looks like for us. Then there's the decision making piece, and then there's the meaning making piece, which is where we really are focusing on the type of communication, and specifically political communication, that is done by people who are in authority positions to try to help the public understand the crisis and what it means for them and what changes it means for their lives. And so if we're thinking about meaning making, this political communication, as I was saying before, I think one thing that could have been done differently is as they're struggling, as leaders are struggling with, do we communicate openly? Do we say everything we know, or do we just try to project confidence? This framework that Claire referred to earlier, the Heifetz framework for adaptive leadership, it suggests that actually, like, one of the things that leaders can do that's detrimental is hiding information from people, which it's obvious that there's a temptation to do that, because if you're a leader in a crisis situation and you're trying to project confidence, and maybe that makes sense initially, but then it comes back to hurt you because it reduces trust. And I think what could have been done differently in this situation is, had authority figures around the world, in different states in the US, had they tried to be open, and instead of I don't know if maybe in some cases there was blatant lies, but at least kind of hiding or obscuring some of the information, had they been as open as possible, then they could have been able to, there's a chance that they could have helped people kind of bring people into the sense making or the meaning making process, and help bring people along so that people could kind of evolve along with the leaders, and as they're trying to make decisions, and kind of take responsibility for some of the things that were happening, instead of just saying, well, the leader told us everything's going to be okay, and now that changed, and now it's the leader's fault, and then the leader blames public health, and then we get this tension that Claire's talking about. So I think this idea of trying to not hide information, but being open and clear with people, even if it might seem harder at first, can end up paying off in the long run. And we didn't see that in very many cases.
Yeah. And I'm thinking of now when, we had all these variants, right? Initially, the government and public health officials and the messiness that Claire talked about, we thought that, this will be over in 2021. We can breathe. And then, no, we have a new variant. Oh, yeah. Make sure you go and get vaccinated against this one. Oh, you all said we only need this one vaccine. Now and there's another variant coming too. And if you live in Africa or you're in South America, there are all these different variants. And so when you look back, how do you think leadership adapted their strategies because of all these things that were emerging? And did you see any missed opportunities, Jeff?
Yeah, that's a good question. I mean, I think that there were lots of missed opportunities. I think that I'm trying to think if there are any positive adaptations. So Claire and Pablo can weigh in if there were any. What I think we saw changes that were made. I think by the time that that second wave, the Delta wave, hit the United States, a lot of this trust had been lost for some of the reasons that you just explained. And so where initially there were many policymakers, just no matter what their political affiliation, were trying to follow the recommendations of public health as best as possible. I think by the second wave, it was a lot harder. They were less willing to tell people they had to stay in their homes for a while. They were less willing to ask people to sacrifice for the greater good in many places. And so I think that's where we saw this. These decisions became even more influenced by political affiliation. And so, so we saw places like in Utah, in my state, and Florida and Texas, where there are other red conservative states, we saw state legislatures banning mask mandates for schools. And then in other states, like California and New York and other more blue liberal states, we saw state legislatures like requiring mask mandates for schools. And so it's quite the contrast, right? You have some states requiring mask mandates, and then other states not just not implementing mask mandates, but prohibiting mask mandates by law. And the only thing that kind of tells you is that everyone's just being influenced by what they want to do anyway, based on their politics. And so I think that's a negative change that I saw here in the U.S. over the course of it, that leaders, instead of, at first they're trying to do the right thing and there's all these challenges, it became a lot easier to just say, well, maybe I'll just do what makes the most sense for me politically anyway.
Yeah. And Claire or Pablo, what do you think about that balancing act and, trying to meet the needs of the constituents, but also ignoring these public health people who keep yapping about masks and vaccines, right? So, Claire?
I think one thing that's interesting to look at, so Jeff was just talking about that framework by Boyne and co-author on crisis leadership. And one of the last stages around crisis termination, and how do you end up returning to normalcy, in a sense, saying the crisis is over, because that's particularly complicated when it comes to outbreaks, because they don't have a clear-cut ending. You can't say that's it, it's terminated. In reality, epidemic outbreaks end when the disease become the new normal or endemic. And in the case of COVID, it's very clear, right? I think we can all agree that we're not, in the crisis mode anymore. And at the same time, there's still COVID cases. At least in California, where I am, there are a lot of COVID cases. And we saw that very clearly in the way public leaders dealt with that termination piece. In France, for example, in 2020, when the crisis started, the president at the time, Emmanuel Macron, say we're going to save lives, whatever it costs. Le quoi qu'il en coûte. And so as the crisis progressed and we were kind of thinking about reopening, it became harder and harder to justify that, whatever it cost. But at the same time, they couldn't kind of pivot and say, well, actually, now we're fine with not saving lives. So what we saw is that they started very slowly reopening, while at the same time, the number of cases wasn't, drastically reducing. So basically, they lightened their requirements while keeping the narrative for the public completely intact. And I think that's a really interesting, way that leaders, I guess in France, got themselves out of a complicated communication crisis.
Yeah. And Pablo, any thoughts you want to add to that?
Yeah, I think that what Claire said was key in Chile. What happened in here regarding that last stage of the Boeing model is that like authorities try to rush into the ending the crisis, and as Jeff said, ex post we knew that transparency and truth would pay in the long run. While in the short run, like politics were thinking about like how to, reduce uncertainty and communicate confidence to the population. And what they used here, and it was a very complex moment. One Ministry of Health was fired for this. They tried to calm people, saying that this is under control, totally under control, and we have like two situations in which communication was not the best in terms of the authority trying to simply declare the end of the pandemic. One in which they said that we were in a new normalcy, like very early in the pandemic, and that was like it was a shame, because after they declared the new normalcy, we kept like living in COVID for like 2 years. And the other was like a problem with the death statistics, which was like a huge mistake. So yeah, I think that the main lesson, as just said, like ex post for an authority, would be just to be as transparent as possible. I know it's difficult when you're facing this period of uncertainty and people are requiring information from you and like expecting things from you, but like put it together and like communicating people that we are all in this, all aboard. And I think would have been like a better way to go. As in France, in Chile, one of the good things that we did, and it is like something that we can say was positive in terms of communication, is that very early they decided to put together a scientific committee with people from everywhere, all the political spectrum, etc., that helped the authority to regain trust in complicated moments.
Yeah, and I want to stay with you, especially on that point of a scientific committee. It was fantastic that there was that open reception. We know that in the US, we had a lot of challenges in trying to trust what the scientific community was saying against the political leadership at that time. And one of the things that we really noticed that was very glaring was the inequalities that sprang from that confusion, right? And Pablo, when you think about the social and economic inequalities, how did leadership in each of these countries address those broader issues? It may look like, it was just a communication problem, but then it dug up old age, things that were already there, right? And at the heart of the community and the society. So what are your thoughts about that?
I think that happened here too. The first month we were looking all day at the TV, like waiting for news and like new things to come and new policies and new restrictions. So we were all looking at listening to what the authorities wanted to communicate. Chile is a very centralized country too. Like I think 60% of the people lives in the metropolitan area. And unavoidable even when you look at the data, even when you try to make evidence-based decisions, you end up like making policies for Santiago, for the capital, for the metropolitan region, and you forgot that there are other people that lives in like differently in other parts of the country. And the same in Santiago. Initially, I remember one authority saying that, you all should like stay at home and just use your phones and like buy groceries and food using the apps. And it took a lot. It took some time after some people start saying, there are people who don't have internet access and smartphones and apps. So yeah, I think that's something you should always have like in mind when doing like public policy, like distributional effects, and whether you need to adapt your overall and your general policy to some specific groups that might not be able to follow your rules or might be disproportionately hurt by some policy. Yeah.
And I think here in the US, similar to some of the things that you brought out, are when we had to tell people to social distance, right? And we have communities that live in large numbers. And so the question was, where are they going to social distance, right? Talking about washing hands, and this is globally, communities that don't even have access to water, right? And then soap, they have to buy that. So I don't know what you think, Jeff and Claire, in addition to those social inequalities that you would want to add that showed up glaringly because of what COVID took us through.
Go ahead, Claire.
Okay, I'll make a small point. I think one piece that's really interesting is the piece related to data. In France, there's a lot less data. Well, no data is collected related to race or ethnic origin, which made it very complicated to show any differences. There was data related to socioeconomic level, but compared to the US, where very clearly and very quickly it emerged that the disease was disproportionately affecting Black and brown population. This wasn't as obvious in France, and I think, and as a result, there wasn't as much focus, I think, on the distribution of the disease and how to design policies that would be different for different people with different needs or different barriers to access. So to me, I think that was a key lesson from the pandemic that I think we're seeing in other kind of public health challenges that are emerging, which is if you don't have the data, then you can't bring it to leaders, and then the decisions being made end up being different. So I think that's one of the key lessons from the COVID pandemic. How do you design very quickly, small experiments that, especially in places when you don't have strong routine systems, data system, how do you kind of make sure you get the data you need to make the right decision? I think that question of uncertainty and how do you deal with uncertainty is going to be quite key, especially in future pandemics.
Jeff?
Yeah, and I'll just add, it's interesting because we saw most places around the world and in the US that we look at the data, poverty increased during the pandemic. But even from the beginning, we had an interesting change in 2020 from 2021. We had a new presidential administration. We saw a change in direction in many things, but there were some relief programs that were passed by the Trump administration and then expanded upon in the Biden administration that I think that may be one area where in U.S. leadership at the national level did a pretty good job throughout the pandemic is trying to get relief to people. Obviously, we see health disparities, we see still a poverty increase. I think it could have been much worse. Interestingly, though, that's one of the election issues is many people are saying the Biden administration did too much to relieve poverty, which sparked inflation and shot inflation up. And, now that one of the issues, maybe we have a different presidential candidate. And so it shows just how hard it is, right? Like that was something that most people, politicians on both sides, agreed upon, that we had to do something for the people that were suffering the most. There were huge programs to help small businesses and to help individuals with different social issues. And that was good. There was an argument that maybe they overshot and did too much. So just one of the challenges of leadership, I think.
I'm glad you brought up the fact that there were policies that worked well across the governments, and sometimes we lose focus, as we say, oh, I'm this political party and I'm that political party and I like this group and that group. And we forget the people in the middle. And this is where those policies make sense. And I didn't even realize that there was that happened. There was a policy instituted in the previous government that continued across this government. So it's good to see that happen. And as we wind down, what are your thoughts? And Claire, you'll get us started on this. Your final takeaways as we look at these leadership styles in the three countries. How can we better prepare for future public health crises that are already happening? Hello, monkeypox. Mpox, and many other things that are on the horizon, right? So what are your takeaways there, Claire? And then we'll come to Jeff and Pablo to give us their final thoughts.
Yeah, sure. I think there's a lot of things we've already mentioned. We talked about political communication. We've talked about the role of data. We've talked about, how to balance scientific public health expertise with the political process, et cetera, et cetera. But I want to bring actually some more recent work that I've done with a colleague, Tim McDonald, who's with the Rand Institute, is a political scientist there, where we've tried to map out where are the public health leadership competencies that we think are needed for the new challenges that we're seeing. And I think, going back to what I was saying at the beginning around the interdependency across the different sectors, the scale of the pandemic, the interdependency across the different countries. There's going to be emerging outbreaks, but we are also dealing with climate change. We're dealing with ultra-processed food and an epidemic of obesity. There's a lot of different topics where we're going to require those same competencies. So I want to go quickly for them. And because I think they're going to be quite important, especially when we think of how do we design institutions that allow for public health leaders to exercise those skills, but also for training of, new MPH students coming. We're in September. You are all starting teaching, all of you. So we came out with 5 essential skills. The first one was the sense of social responsibility and desire for impact. And by this, what we meant is having a deep commitment to the final impact. So, if what is needed is something that's outside of the public health realm, making sure that we're able to advocate for that. If it's advocating for animal health to be able to improve public health, so be it. The second piece is the intersectoral vision. And I think we talked about this quite a lot already, but how many public health leaders really understand education or defense or urban design? And I think we need to have a better understanding of how different pieces of the government play to be able to talk and really think together. When we think about COVID, there was such a huge piece on education. How do we have this dialogue moving forwards to make sure that goals are aligned in a sense across different disciplines? The third piece is this idea of systemic wisdom. So this idea that it's not just about understanding the different sector, but understanding how systems work. And Jeff can say a lot more about this because it's a lot of what he does. But how do you redesign big public systems in a sense? How do you start thinking across the different borders of different discipline? The last, the fourth piece, we've talked about it as well, is around uncertainty. And I think we're also, if you think of Mpox or if you think of upcoming outbreaks, we're going to be in situations of deep uncertainty. There's an emerging field of statistics and math that's really around that. How do you make decisions under uncertainty? There's a lot of thinking going around that. How do we bring those tools to political leaders, to public health leaders to say, this will help you in how you can manage your decision-making process. And last but not least, there's an issue around change management and how to accompany people, to accompany them on the process of implementation and really start thinking, people are going to lose in a sense. In the case of COVID, to protect some people, you had to give up some of your, freedom of movement, for example. How do you, as a leader, accompany those people through change and make sure that you remain focused on the impact? I think is going to be quite key. So I think these 5 skills are really, some of the takeaway that we can take from COVID and some of the competencies that are going to be necessary for the future challenges that we're going to face. Again, climate change being probably the biggest of them all.
Indeed. Jeff?
Yeah, I agree with Claire in this idea that we need to make public leadership training and these leadership competencies a bigger part of public health education. I talk with my students a lot, and I teach a policy class where we talk about the politics of policy making a lot. And it's really uncomfortable and foreign for a lot of public health students who come in from often more STEM fields or science, interested in data and epidemiology. And I think we need to start working to change the mindset. I feel like there's this feeling in public health that we should be above the politics, right? We are about the data, and the politics, that's too dirty. We don't want to play in that playground because there's no evidence there. But I think that hurt us during the pandemic because we weren't there. We weren't at the table. People didn't understand what we had to offer and what we did. So I think that's a really big thing, is starting in public health training in the U.S. and around the world of making sure people understand what politics is, how to analyze the political dynamics of a situation, how to get involved in advocacy and political decision making. And then the other thing I'd say, Claire talked about intersectoral work. And I think that that is the role. Could be the role of anyone in any sector. I think as far as policies that affect health, I think that's a role that public health needs to seize on and say we are that intersectoral navigator, understanding what's happening in different sectors and helping to figure out what that means for health, and getting involved in the politics and the decision making in those other sectors to help health. And I think part of that is just the broader, for thinking about, I don't think polarization happened because of the pandemic, but I think it illustrated political lines and polarizing divisions that we already had in society in the US and again, all around the world. And I think that there can be more but that everyone can do. But I think we can do this in public health and work intersectorally to do more bridge building across differences, political differences, ideological differences, religious differences, racial differences. And I think that will help not only now, but then I think the next pandemic, when it comes, if we're doing that work, and I think we should be leading it in public health along with other disciplines, then I think that helps us. We're in a better position where even if we see something differently, we can recognize there are multiple legitimate perspectives on this, and how do we come to decisions together without splitting into our own tribes that can help us make it through the next crisis.
Fantastic. And Pablo, close us out.
Sure. It is really hard to add to something after Claire and Jeff's intervention, but I will highlight what Claire and Jeff said. That I think if we can say that something worked during the pandemic, we can probably say that the things that worked were those in which collaboration some kind of collaboration arose. International collaboration between countries, collaboration between disciplines, whatever. I mean, we are 3 people. We have like a friendship Thai, but we come from different countries and different disciplines, and we met here in this area of public health. As Jeff said, I think particularly for public health practitioners, professionals, there is a role in articulating this collaboration between disciplines, and I think that's the main advantage that today, as a discipline, we have. We are in nature interdisciplinary, so it is a good starting point to try to coordinate other people to face these new challenges, in which more and more will be like would not be possible to solve just using one lens. So that can help like navigating uncertainty too, right? Putting together, as Claire and Jeff said, like different perspectives, different visions on the table, and like making decisions based on that, instead of like trying to fight for, instead of fighting between like different disciplines for who has the best option alternative, or has the truth. So my main takeaway is that like interdisciplinary work is the key, and that leadership in public health can be really important in the future to help articulating these collaborations.
Wonderful. So with that, we come to the end of our episode today, and the impact of COVID-19 continues to unfold. But by examining leadership in these countries, we have gained valuable insights for navigating future public health challenges, hopefully. Thanks to Pablo, Claire, and Jeff for sharing their expertise and teaching us the importance of being not just being siloed, but reaching across the aisle, but also remembering that public health is messy. So join us for more public health discussions on Public Health Musings. Subscribe wherever you get your podcasts, and share with your fellow public health warriors. And once again, thank you, and a big clap to our guests today. And I will call on you again to see what else you're doing. And I appreciate that the three of you are working together, and you have this information from 3 different countries, but also USA being your central country as well. And I look forward to inviting you again in the next upcoming episode. So have a good one, everyone. Thank you.